Healthcare reform has provoked passionate debate across the U.S. this summer. Overlooked by many, however, is the future of the Medicare system. I'm Brian Simpson, editor of Johns Hopkins Public Health magazine. To learn more about Medicare reform efforts, I spoke with Chad Boult, director of the Roger C. Lipitz Center for Integrated Healthcare at the Johns Hopkins Bloomberg School of Public Health. And you talked about how Medicare is not, sort of as it is now, is just not sustainable in the long run. Do you feel that there's sort of the changes kind of in the works to sort of correct this, or is it going to take like a even like greater crisis to actually bring change about?
Those of us in the field of gerontology have known, written about, and talked about for 2 decades the coming crisis with Medicare, because it's really just driven by demographics and new healthcare technology. We've known that it's not sustainable. We've made predictions about when the Medicare trust fund will go broke. The only thing that's really changed is that we're getting closer to it. And the most recent prediction done by the impartial Medicare trust fund itself is that 8 years from now it will be in deficit. So the current administration could even still be in office if they got reelected. So it's no longer possible to, as they say, kick the can down the street. It's going to happen in the really foreseeable future. If the Medicare trust fund enters deficit, it just simply can't pay anymore, and this will be a real catastrophe. So now that's probably the reason why the Obama administration has given Medicare or given healthcare reform such a high priority. If this legislation, if the healthcare reform that's being debated now does not pass in some meaningful way, we are going to be in a real crisis situation, because it won't be possible then to raise it again until it's far too late. This is it. This is the time we have to do it. Even now is fairly late in the game, but to wait another 4 years to begin the process, it would be truly too late.
Can you connect the dots for us? Because a lot of us, sort of as a layperson, I think of the healthcare reform effort right now as sort of managing costs, but really extending healthcare insurance to all the uninsured. How is Medicare part of the debate that's going on right now?
Well, the healthcare reform that's being talked about is a multifaceted monster. It involves several goals simultaneously. As you mentioned, on the one hand, it tries to make sure that all Americans are covered by some form of health insurance. And it also tries to address the Medicare problem. And there are other goals that it has as well. So it isn't just one challenge that the reform legislation is taking on. It's several.
It seems like, with Medicare, you either have to sort of delay sort of when people come into the system, or you have to ration care. You have to ration care. I mean, do you know what I mean? That seems like, and that seems to be that proverbial third rail there.
So if we just focus on solving the Medicare problem, that is the fact that it is projected to go into deficit within 8 years, there are limited options for what we can do about it, and one of them is to raise taxes on the working force of America to pay for the older folks that are getting Medicare. That's not too politically palatable. Another approach is to reduce the expenditures of the Medicare program, and that can be done a couple of different ways. One is to delay eligibility from age 65 to, say, age 70. Then you'd have fewer people on Medicare. Another is to reduce the benefits that Medicare provides. Right now, Medicare provides pretty complete benefits. Anything that a person needs, Medicare pays for. So that could be restricted. And that, of course, has many people very worried. They worry about rationing of care and who's going to decide what you can get and what you can't get. The approach to reducing Medicare expenditures that I think receives the least amount of publicity is the one that we've been focused on, which is actually improving the way that healthcare gets provided to be more efficient. So to avoid unnecessary expenditures, like avoiding unnecessary hospitalizations, has the potential for saving substantial amounts of Medicare dollars. It's not the whole solution, but it certainly is the one that doesn't seem to have any political enemies.
And do you have any predictions for how you expect things to turn out? Do you think it's going to be maybe kind of a sort of a compromise, sort of hodgepodge that's not going to solve the problem, or are you more optimistic?
I feel pretty sure that it's going to be a compromise. I mean, you're seeing this happen even today. We heard that the Obama administration is beginning to back away from the idea of what they call the public option. In other words, a government-run insurance program, sort of like the Medicare program, but for younger people. That's been a real lightning rod of the opposition to healthcare reform, and so it may be that is omitted from the legislation. There may be other compromises along the way, but clearly that's the way our democratic process works, is by making enough compromise so that there can be a majority to support whatever it is that we come up with. My fervent hope is that what we eventually end up with will be a meaningful reform package. We've spent the last 20 years talking about Medicare reform and nibbling around the edges, tweaking it here and there, and not really substantially changing the fundamental problems that plague the Medicare program. And I just hope that we don't do that again. Hope that we don't compromise so much that we end up with a reform that isn't meaningful.
Well, thank you very much for your time.
You're welcome.